Welcome back to PPCM's Painful Truth. Today's guest, Katie Turgeon.
All right. Hi. How you
Hello.
doing?
Good.
Did you shut the bedroom door? Sorry, my puppy. Maybe you take him for a run. He's on one right now. Okay. Him and the cat. Hi, Katie.
Hello.
Thank you so much today talking with me about peripartum cardiomyopathy, PPCM, as well as like your experience on how you were educated with this preventable disease. I know somewhat about your story, but why don't you, I think you were diagnosed in 2008?
2009.
2009.
Yep.
Why don't you tell me like where you're from? Tell the viewers how old you were when you were first diagnosed with peripartum cardiomyopathy.
So I live in New Hampshire. I was 23 when I was diagnosed. I was technically my second pregnancy because I had had a miscarriage before. So my first live birth. Throughout most of my pregnancy, I was very sick with morning sickness in the beginning, had to take Zofran for like 20 weeks, I swear. It was like ridiculous. So after the sickness subsided and, entering that second trimester where you're feeling better, I started having a lot of swelling in my legs, started having high blood pressure readings. I worked as a medical coder an hour away at the time. So I was traveling about an hour to work each way. So that's a lot. It's like 10-hour days when you're already working an 8-hour shift. So I had called my doctor. I was working at a medical coding office, but at one point I was traveling to a workers' comp office where there was a physician in the office. So I had showed him my legs and he was like, yeah, let's check your blood pressure. Called my OBGYN from their office. They wanted me to come in. Because I had been having issues like at all my appointments. So like every time I would go in, my blood pressure would be high. So with the swelling, it was like one leg. So they were like, yeah, well, maybe you have a blood clot. So like they drew on my leg with Sharpies and they sent me over to ultrasound to have my legs scanned to make sure I didn't have a blood clot in my legs. So, that was good that they were doing that, but in the same breath, like it was negative. So there was no blood clot. So I'm still having high blood pressure. I'm having swelling. I'm in my second trimester. Yes, I sit all day at an office. So, you're sitting down. It's typical to have the baby, sitting on your legs and causing swelling. So they kind of just brushed it off as, you're 5'2", you've got baby weight on you, putting pressure on your organs. So it never really amounted to anything like, we'll check you, like come in. First, they check my blood pressure, have me lay down. It would go back to normal after I lay down for 5 or 10 minutes in the office. So throughout, that was like my back and forth throughout the whole time. Knowing what I know now, they probably should have sent me for a BNP at that point where my blood pressure was high of having the swelling. So fast forward to the end of my pregnancy, they wanted to induce me because my blood pressure was not getting better. I was still having a lot of swelling. I ended up getting like a viral infection like the last 2 weeks before I was going to deliver. So I ended up having to go out of work early because I was just so sick from whatever virus I had. And when I finally, told my doctor, like, I'm done, I can't do this anymore. I'm so sick. My blood pressure, I just don't feel well. So they said, okay, let's induce you. Like, you're done. Your blood pressure is too high. It's not like getting any better. So of course I live in New England. There's snowstorms. So I got bumped back from my induction because it was snowing and there were so many people that were there in natural labor. So I, again, got bumped back even though I was having all these symptoms. So they finally got me in the day after my due date. So it was March 1st was my due date. March 2nd was the day that my daughter was born. So I went in that morning, put me through induction, did all the whole 9 yards. And I ended up in emergency C-section because my labor didn't progress. My blood pressure was March 2nd of 2009.
No, of how many weeks pregnant, I mean?
Oh, I was 40 weeks one day.
Okay.
So just one day past my due date.
So
and ended up with the
your baby
emergency.
should have been born way sooner than that.
Yeah, she probably should have been. They did the C-section. It was like 10:30 at night, so it was really late. So I was tired, I was exhausted, and my blood pressure still was really high. So they were like monitoring me, but it wasn't like super close. And then, so I had two doctors in my office, and one of them came in because my OB had gone home. He was on call that day, but left in the afternoon. He was done. So the on-call had come on. So the next day, I remember his partner coming in, and she was like, your blood pressure is really still high. We're going to give you magnesium if it doesn't come down. And I was in the hospital. I delivered on a Monday, and this was like on a Thursday. So I was let home on a Friday on like just a blood pressure med. And they were like, follow up Monday with OB. And I was like, okay. So it was Friday night. I went home, dealing with a newborn, still not feeling really well, recovering from a C-section.
Following up with a cardiologist?
Nope, they never brought a cardio into the maternity floor at all to evaluate me.
And they never provided you during pregnancy any diagnosis to determine this disease?
No, I had never heard of it. So I had seen like postpartum depression and all the other pregnancy related diabetes. I'd seen all those flyers, pamphlets, everything in the office. Nothing about peripartum cardiomyopathy.
Exactly.
So Saturday, Sunday, I was home. I remember laying on the couch with my newborn, feeling like her head on my chest and literally feeling like she was like an elephant, like sitting on my chest. And I said to my sister, because she was staying with me, and I said, she feels really heavy on my chest. I feel like I'm having a hard time breathing. So I ended up calling to the maternity floor, and I was like, I was just released yesterday. I'm really not feeling well. Something's not right. And they said, well, maybe you have post-op pneumonia and we want you to call primary care. So I was just released 24 hours ago from maternity, and they telling me to call primary care. So I called primary care Monday morning because it's the weekend.
Right.
So primary care is not even there.
No,
They're like, you can go to the emergency room or you can go to primary care. Right. So I called primary care Monday, and they were like, come in, like, we want you to come in. So I remember walking up the stairs of my primary care office because my husband had my daughter in the car seat because I couldn't carry her. And I literally just like collapsed into the chair that was sitting next to their check-in counter. Just couldn't breathe at all. So they finally got me in, took my blood pressure, and it was, I don't even know what the number was, but it was sky high, to the point where she was like, I'll be right back. And she went and called my OBGYN, who was downstairs. And he was like, get her to the emergency room, like put her in a wheelchair, have her husband take her, but get her over to the emergency room. I'm calling and letting them know she's coming. So when I got there, it was packed. It's, of course. So they're like, well, I'm crying. I have a newborn who's screaming. And I'm like telling the nurse or the whoever it was that was checking me in, like what I was dealing with. And he was like, well, maybe you have a blood clot, in your lung. We're going to get you checked out. And I'm like, okay, sitting, waiting, newborn screaming. I need to nurse her. And I had no private place to do it. I'm 23 years old at the time. So I'm new to breastfeeding and all of that. So they put me in like a little triage room, which was fine. Then they brought me right in with like the primary care, the on-call ER person came right in, and he brought me back for x-ray. So they gave me a chest x-ray to start. As soon as they saw my chest x-ray and brought me back to the room, I had a cardiologist coming into my room. So as soon as the radiologist saw my heart huge on the x-ray, they had an idea what was going on, but they immediately called cardio, which luckily for me, being in a small rural, I'm in the capital city, but we're a very small hospital. It's not like being in Boston or anything like that. So luckily this cardiologist that was there, he knew what peripartum cardiomyopathy was. So he right away wheeled an echo machine into my room. They called OB on call. The OB doctor was literally holding my baby while my husband and I's jaws were like on the floor telling me that I'm 23 years old and heart failure. And they, basically told me you can nurse your daughter one last time, and then we're putting IVs in you and you're going up. They luckily let me stay in PCU instead of ICU so that she could stay with me, because that was like, I've never been like so anxiety in my life to the point where they gave me like Xanax to calm me down because I just would not stop crying. And, being told you can't have another baby you can't breastfeed your child, you can't do this. And at 23 years old, nobody wants to be told, hey, this is it, you're done, you can't have another baby. So I was grateful to be at a hospital with a doctor that knew this condition, because being so rare, nobody knew it. So I immediately, the next day after they had given me the Xanax, calmed down, I called my OB and I was like, you need to get over here and you need to tell me what the hell is wrong with me and why this happened to me. And he told me that he's had 6 patients that have had this condition. So he knew it. And I don't fault him for not, doing it. I feel like if the OB community was more on board with doing this testing, he wouldn't have even questioned it, because it would have just been part of his routine. Hey, you've got this, let's do this, and just double check you. But that's not part of what they're trained to do. So they're not thinking, hey, this 23-year-old girl's in heart failure. She's just, 5'2" and 9 months pregnant. And so it literally took a week after my birth to get a diagnosis. So I was lucky that it was only 5 to 7 days, but some women go way worse. My ejection fraction was 18 to 20% is what they estimated it at. So pretty much had I not gone that day, my husband could have found me on the floor, collapsed in cardiac arrest for all I know. So that, I have a lot of post-traumatic stress regarding my heart now, and knowing, could this happen? Could anything happen to make this happen to me again? Which, doesn't help when I also have a thyroid condition. I just experienced like a bout of hyperthyroid that gave me palpitations. And literally for 2 months, I've been like on a roller coaster ride with, is my heart affected? Did something, change in my body that's affecting my heart again? And to the point where like, I've already had my daughter screened by an echocardiogram to make sure she doesn't have anything going on now. Even at 12 years old, she'll be 13 next month. And
yeah, I do the same for my son at 5. I mean, our PPCM babies are definitely they're studies, like we are studies. Yep. We are putting this PPCM puzzle together. Each woman who comes and talks about their experience, you learn something else pops in that's interesting, that kid, figure out where, especially in the United States of America, why there's so much lack of training, like you were talking about, policy and practice with, with what we know and with what, we're learning. I mean, that's what medicine is. It's practice. And so when something is made aware, like you said, your doctor has experience because other women have had this. So obviously he knows that this is common. It's not rare. There's just rare for any diagnosis in the United States of America, because OBGYNs and gynecology do not have the standard testings and treatment. They have it in cardiology, but we're not going at 23 years old. You're not going to a cardiologist to give birth. You're going to a gynecologist. So
exactly.
Really.
So I did have a post-pregnancy, even though, they told me no. Right. So I was very adamant about, I saw the doctor who diagnosed me. I was going to say, how much later after your baby did you have another birth, and was it a different pregnancy? Did you experience a relapse, or how did that happen with you with your second pregnancy? They are about 2 months shy of 3.5 years apart. My son is my post PPCM baby. He'll be 10 in July. So I was followed by maternal fetal medicine. I chose a cardiologist at the New England Heart Institute at Catholic Medical Center, who is their heart failure specialist. I got all the research from Dr. Fett from our heart failure group on, the step-by-step of what you should check off your list before you attempt a post-pregnancy. So I talked to Dr. Capitalupo, who was the cardiologist. He agreed to do a meeting with me. We discussed my case, my recovery, how long it took for me to get back to a 55% ejection fraction. He then set me up to do the stress echo with the contractile reserve to make sure that my heart was, recovering good after being up to the highest, exercise that they wanted me to get to. So my echo was good. The contractile reserve was good. So they said, okay, let's take you off your carvedilol. So I went down to the lowest dose. I weaned down for like 2 weeks and they told me to just stop it. So they did another echo, I don't know, about 3 months after I stopped it to make sure that nothing had changed. Everything was still stable. So they said, yep, we're good with you going off your birth control. So I count a lot to Dr. Fett's research and making us all aware of the newest, breakthroughs and what they're finding. And he did trimester echoes. So I had one first, second, third trimester. Even though I gave birth at a different hospital, he communicated with my OBGYN to say, let's do a slow drip during your repeat. I had a C-section again, because they didn't want me to stress through a natural birth. And I had already had a C-section. So they did a 38-week, 5-day delivery. So it was a couple weeks earlier than my daughter. I had the morning sickness again with the pregnancy, but it was about 13 weeks and it subsided. I did not have the swelling. The only real difference was I was a stay-at-home mom, so I didn't have that stress of traveling and working because I was just home with my daughter. So that made a big difference, being able to just, relax and not have to be driving 2 hours and working 8-hour days. So I was admitted to do my C-section. That went fine. I then was screened by echo the day after he was born, and everything was still normal. And then about 6 weeks after, they screened me again, and then 6 months after. And I had probably about 5% drop. I think I went from I was 60 to 65, and they brought me down to 55. But it's now back up to 60 to 65. Yeah, so they didn't consider it a relapse just because it was still normal.
Okay, so your second pregnancy, you did not have the same symptoms. It was
Nope.
You did not have peripartum cardiomyopathy with your second pregnancy, but you did with your first.
Yep.
And they told you that you couldn't have children at 23. So if you listened to them, you wouldn't have your son today.
Exactly.
And how is your recovery today? What is your EF % today?
So I'm being screened. I'm going back to see Dr. Capodilupo. He had released me after my 6-month follow-up. He said, if I didn't know you had heart failure, I would say that you never had heart failure based on your screening. So he's like,
sure.
I'm good with you, not coming. I still demand echoes every other year by my primary care, which my primary care just retired with the whole COVID pandemic. So I had to go back to a different doctor who doesn't feel comfortable ordering echoes for me. So she wants me to go back to be under cardiology care. I had COVID over Thanksgiving. So I requested a post-COVID echo just to make sure that everything was still good. So I'm seeing the doctor again, in 2 weeks. So I'll have another echo set up
Okay, you keep saying echo, which is amazing. What's your BNP test number, since that's what we are actually striving to accomplish for maternal mortality as early diagnosis as we continue every year of monitoring our BNP test when we get our echo. I have one come up. I also have for my son, I have his EKG and most importantly, his BNP. So I am always now knowing that it's the only test that will determine. I always ask, what is everybody what's your BNP test when you were peripartum cardiomyopathy, and your BNP test today number?
So I don't know what mine was at admission, because back in my records, on my eChart, they don't have it. They have my echo. Wow. I mean, my chest X-ray from the day that I was admitted, but I don't see any of my labs. So I don't know for sure without calling my old cardio office and asking. But when I did have my issue with hyperthyroid, back in the beginning of October, they did a BNP on me because I was having palpitations and I was having...
What was that number?
So let me just quickly log in, because it was on my... I didn't think to have this out before, but it'll only take me 2 seconds.
That's fine.
So it was elevated a little bit when I had my my hyperthyroid. So like obviously having had cardiac symptoms with it, I was concerned, and I see a naturopath for my thyroid. So she was following me with that. And she just checked it again a few months after, and it had gone back down to normal, which is really good. But I have had it done a few times in regards to like being at the hospital. And I don't know, like I've had bouts of pneumonia in the past, and I've brought it up to all the staff that, you know, I'm dealing with at the hospital that, you know, hey, I had heart failure, and like when I'm dealing with pneumonia, I want you to make sure that my heart is good and not have any, you know, thing missed. And it's amazing how many people working at the ER.
What's your BNP today?
I'm trying to get into it here, but it won't.
Oh, okay. Okay. I'm sorry. I thought you were looking at when you're pregnant. Yeah. So basically with all the tests that you had, what was the test that that diagnosed you for peripartum cardiomyopathy? Was it the NT-proBNP, or is it from them looking at your heart? Can you turn your camera down just a little bit? Okay, yeah.
Doesn't want to go down further. There we go. I had to push my monitor
great.
back. So I would say it was probably a combination, because I had the chest X-ray first, and I don't know if that's what prompted them to do the BNP, was because my heart was literally like the size of my chest on the X-ray. So obviously that's like, hey, red flag.
So it enlarged.
I don't know. I don't remember if they drew blood before they took the X-ray, or if they just sent me in because I was having like shortness of breath and like heavy chest. So they were just like when I went in, they were really thinking I had a pulmonary embolism. So that was like their main thought process was like, oh, you know, you must have a pulmonary embolism. So I was like, okay, like, let's just get it screened. So I know for sure. And that's when they sent me to the chest X-ray. So I know after that I had double IVs put into me with like lots of medication. So I'm assuming when those IVs were put in, they either drew the labs or they had done it right before, but it was such a whirlwind. And I don't really remember for sure what order it was in, but I know the chest X-ray was what prompted them to call cardiology. So if they didn't do that chest X-ray, I could have been sitting in that ER for many more hours.
Absolutely.
Sick, without getting an instant cardiology attention.
Not getting any proper health care for you to stay well.
You know, I definitely think that is like the first thing that triggered them to look, hey, this is definitely not pulmonary, this is cardio, like this is definitely her heart. So I thank God every day that doctor knew what this was when and he was the one that was on call, because if it was a different doctor, I could have had a really different outcome. Luckily.
Yeah, it could definitely have been a different outcome, you know, and you know, you could be anywhere in the United States of America at the best hospitals, but really those doctors are the ones that rent out the space, like, you know, like a shopping mall. And like, you know, so when they say the best hospital, I'm like, that doesn't make sense. But if it's the best doctor, it's because the doctor has awareness, not because of the plaque that he has if he went to like whatever school. Like I remember my gynecologist, she kept saying, oh, I had the best education at blah, 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 blah. And she kept looking at her computer, and I was like standing right in front of her saying, I'm right here. Like, no, you didn't have the best education. And no, you know, you had no awareness that, you know, that the entire pregnancy, you know, I was dying and then had cardiac death and then saved and lived. And now I'm to tell you and educate you, these doctors, they are not trained, educated. And once they are provided the education, they don't do really anything with it, which is why I started this platform and this docuseries and podcast, because on November 21st, 2021, at the same hospital, same doctors that treated me, a woman died after childbirth. And they didn't listen during pregnancy. They, you had all this treatment. I'm so sorry. Like, I could feel like, your frustration, your anger. I mean, even like, at 23 years old, because this is a young, healthy, woman's pregnancy induced complication.
Yeah.
You're healthy and fine until you are pregnant. And unless there's actual, like the screenings that you were talking about, the labs that you're talking about, as well as all the testings that you literally just all of those.
I was able to get my BNP numbers for you up. I did get them.
Yeah, all of those that you spit out should all be already mandatory and standard in the United States of America, because this is where the issue lies. All of that you were talking about is what we want to raise the standards for the care during pregnancy, so the prevention and the treatment can be applied, before there is a life threat.
Yeah.
I feel like I'm angry for you that you had to go through that.
It's frustrating
with your doctor having awareness.
And I still see him to this day. And I still see him to this day. I'll see him in a couple weeks.
Sure.
And we have a really good relationship, luckily.
Sure.
And, we've had many conversations about what happened, and, him being proactive about when women have these symptoms that I had, about doing something about it. So I did get my BNP numbers. They have 4 numbers on my chart here.
Okay.
In 2016, it was 55. In 2020, it was 79. Just back in September, when I had my hyperthyroid issue, it went up to 168. And then October 27th, it was back down to 95. So that was the last one that I had, was on October 27th, and I was sitting at 95. But when I had a hyperthyroid event that I was having palpitations and cardiac symptoms.
Was this an NT Pro or was this a BNP? Is it NT Pro?
NT Pro BNP.
Okay, NT Pro BNP.
Yeah.
So that number, if people that don't know what a BNP test is, that's watching this right now, they don't understand what the numbers are. A BNP is a B type blood test. It's a simple blood test. It's called a brain natriuretic peptide, and it tells you the levels of the amount of vessels that are surrounding the heart. And once those levels are elevated, they can indicate something that's wrong, whether it's cancer, dementia, thyroid. They just know that something's not right. And then they start doing more testings. Once you're past 99 for, I guess, the regular BNP 99, you have a fluid disease that's going to turn into a disease, and you need treatment immediately. And that's the number. Anything below 99 is like a 50 is normal. You can even be a -2. You can be a 25. You could be a 47, but you don't want to get past 99. But I believe the NT Pro is any number below 300. So
yes, I have it on here, and it says that less than 50, if it's greater than 450, then like you're definitely in trouble. So like it does say around 300. It says 0 to 450. So at 450, they're saying you're over.
For me, when I had my cardiac arrest death, my BNP was in the thousands.
And I wish that it was on here, because like this is the same hospital that diagnosed me. So I don't understand why they don't have anything.
They probably didn't run the test. Maybe they didn't. But at this point, it's at knowing that, sorry, heart failure, not COVID. When we know, and have the awareness of the BNP, especially as PPCM survivors, things come up. Our body has been through such trauma physically, mentally, but more but with our physical organs. And so, things happen because of the trauma, our gums, our teeth, need more maintenance, like it's almost like we have to maintenance our entire body, because with trauma, it does affect, but the BNP test as PPCM survivors should also be mandatory because, now I could say I'm a cancer survivor. I would have not have known unless the BNP test, if I didn't have it for my heart failure, I would have not have known that. And I probably would have woken up with stage 3 or 4 cancer. But, whenever our body goes through such traumatic experience, and it's almost as if for the rest of our lives, these tests that should be mandatory during pregnancy is now mandatory for the rest of our lives. So all our follow-ups, the EKG, the echo.
If I feel I have to go to the hospital for a reason and I feel like it's related, I'm demanding that they run these tests. I'm telling them at check-in, I am a heart failure survivor. I don't know if something's going on with my heart. And it's not the best way to do genetic testing, but I had done the ancestry, and you can take your raw data and run it through genetic sites. So I did that. And because Dr. Fett's pushing of knowing if you're mutated on the Titan gene, and I have 2 copies of the mutation on that gene, according to my raw data off of Ancestry. So it's one of the things I'll be bringing up with the cardiologist when I see him in a couple of weeks, about him doing official genetic testing to determine if I do have 2 copies of the mutation, one from each of my parents, and what that means for me going forward. Because if something like COVID or another virus or anything else could be a trigger for my heart to go into heart failure again, I would like to know that I'm at an increased risk of that. So I think, women like us doing that genetic testing with their cardiologist to know if they are genetically at risk, because it affects our children going forward too. I could have passed that on to my daughter. And then when she has a pregnancy, I'm going to be on her doctors, making sure that they're aware and making sure that she is protected and covered and nobody's missing anything when it comes to my child having a child in the future. And the same thing with my son, because he could have that gene too. And we know from Dr. Fett as well
I'm personally convinced. Yeah, absolutely. I'm personally convinced that it is on both sides of my family. I actually have my cardiologist, Dr. Carol Watson. She has placed an order for that, and I'm going to get that. I think that's so important for, as well as not just for, I don't have a daughter, but for our sons as well. We don't have enough studies that. We do know that, there is, I think there was something that brought up with, the mother having let's say a positive blood and daddy having B negative, and then it creates, chemistry, chemical factor. And then the baby's born. And then let's say that is that they made that egg, and that they can't have kids, and that egg was implanted into a surrogate. That surrogate can get possible PPCM from how the baby was made, not because necessarily
those parents' genes, and
because
also,
of the genes.
And also, we're not supposed to be organ donors. We're not supposed to donate blood. We're not supposed to do any of that.
But we don't know that. But the thing is that women who, let's say, can't have children wouldn't know to check if she has that gene to implant it into a surrogate,
another woman.
And so when we talk about this, like, about we're trying to figure out also from the labs, like what with PPCM, what comes first, the chicken or the egg?
Yeah.
You know what I'm saying? Is it made through the two parents? Is it made from, the baby? Because, more surrogates are coming up as, they're here wanting to give their bodies to give life, and then they end up dying in the process.
Yeah, and then your kid feels bad too, because when we talk to our kids about it, and she's
Absolutely.
like, "Mom, did I do this to you?" And then she
Yes.
kind of has like a guilt aspect of it. Did I almost kill my mom? And I'm like, no, it had nothing to do with you. It just was a factor of my
It's
pregnancy.
the doctor's mistake.
It's
his fault for not checking during pregnancy.
They missed it. They didn't catch it early enough to the point where, and I tell her, like, if it had gone any longer, like, we could have lost you as well. Like, it's not just the mom that's at risk with a non-diagnosed peripartum cardiomyopathy. Your baby is now at risk. And if they don't catch it soon enough and you go into cardiac arrest while you're still pregnant, your baby and you could be gone. So
right.
It's scary to
There's
put these thoughts into our kids' heads, but we have to tell them and have to explain it to them.
There are so many studies that should be out there. There's studies that we do have that we're not aware of. And then there's the studies that we are aware of, but nobody else is aware of. And so, there are just so many layers of where, the fact that we're women talking about this, and women been giving birth since the beginning of time. And, this should always be like an ancient conversation, but we're having it for the first time, stating that, the handbooks of gynecology need to be thrown away. There needs to be new education, new training, new update on the standard testings. There needs to be new studies out there. Get creative with ideas of like what new studies should be, that because, we know what we know, we don't know what we don't know. And we just have to just keep communicating, and hopefully that we can help put the pieces together for the medical community. So they are also, we're all in this together. You know what I'm saying?
Yeah, and I would like to see, like, when they give you your new mom packet at the hospital and they're telling you, watch for this, this, and this upon discharge, but nothing ever is put in there about peripartum cardiomyopathy. If they just put a pamphlet or a flyer or something in that booklet of information that they give you, then moms would know. Or, in the bathrooms, when every mom's asked to go to give urine at your appointment, maybe on the back of the door, they should have a peripartum cardiomyopathy poster. We have postpartum depression one.
PPCM, we have a downloadable flyer on our website at, ppcmfund.com. And we have a downloadable flyer, and we update them every single year for offices to use, and I call them and I say, and I have other survivors that call, and hospitals in the United States, and ask and request if they could, possibly print it and, just educate, put it in the waiting room, put it in the bathroom, give it as just like you were talking about. Mm-hmm. And it's never happens.
Nope, it doesn't.
It's been 5 years. 5 years.
Bring it up to my OB again and see, if he would be willing. Because when I was diagnosed, he was at a small private practice, but now he is part of a large Dartmouth Hitchcock Medical Center practice in New Hampshire. So I'm going to bring it up to him again and see if I provide him.
We have a downloadable flyer. We have all material. The links of, Dennis, Dr. Dennis McNamara, Dr. James Fett, the IPAC Research Lab, the studies, the rebirth phase 1 and 2. There's over 30 centers at the IPAC lab at, University of Pittsburgh. They have so many studies. We keep updating the website. We'll keep updating the flyers. We hope that maybe, survivors that do have relationships with their OB, that they would allow that. I don't have that really relationship. I do with my cardiologist that's collaborating a study with gynecology at UCLA. I'm going to talk to her about that, about, maybe she can have the approach as opposed to me. I think me as a patient survivor, they won't do it. But if maybe another cardiologist provides it, maybe there will be
It'll
change.
be taken
We
better.
we don't know what the approach is to have this, connect, but I guess we'll try all different approaches and we'll see which one sticks.
Yeah. And I told him, I said, if you ever have a patient that you come across that's diagnosed with this at any of our local Concord hospitals, you call me and I'll go in and I'll talk to this woman. I'll let her know that, it's okay. And that's one of the things that they did do for me, because you feel so alone when you're diagnosed, like,
Yes.
because you've never heard of this. So you don't know anybody that's had this. And they had a nurse at our hospital that had this. So she actually came and she talked to me in my ICU room. And, she wasn't the most personable, and it was very little research still at that time. But it was nice to say, hey, I went through this too. And I have told Dr. Chaudhary, anytime, if you have a woman in this local hospital and she wants somebody to talk to, call me. And he has my personal cell phone number. I tell him, call me. I'll go to the hospital and I'll talk to her. I'll talk to her husband, whatever, and let them know that, it's really scary, but there's so much research and there's so many things now that have come about. Like, I didn't even know that I could have breastfed my daughter on the meds that I was put on.
It's so common. This disease is just so common that it's so easily prevented. So yes, you're absolutely right. I mean, it's all a matter of also not feeling, me personally, I felt like even with a group of on peripartum cardiomyopathy, I felt totally alone. I was, bullied by my hospital. It was like my fault. I had a defibrillator in when I'm a very healthy girl my entire life, waking up with just having a baby and all of this happening. I didn't know who to go to. And I didn't feel like nobody could relate with me. And, and I kind of shied away even from the group site because I didn't understand it. And it was so overwhelming for me. And then I just sat back and I'm observing. And I'm a sociological observer by, nature and with what I do and my background of education. And so I noticed that there were so many people that on our group site, our Heart Sisters, that are just literally suffering with barely any advocacy. And most of them just want justice. They want to be heard. They want justice because this is a preventable disease. And we still, in America, which we pay tons of money for our health care, and we have less than zero respect, support, and change. And so seeing this over and over and over, day in and day out, years going by, me calling reps and companies of kits and instruments for gynecology to have for diagnosis, and it not being approved through FDA as 1 year goes, 2 years goes, 3 years goes, finding out other countries have it, Canada, the UK, Australia, they have the diagnosis, they have the kit in gynecology. Why don't we Americans, women, have that? Canada doesn't pay for healthcare. They don't pay for insurance every month, and they get the diagnosis. Like, what are we doing wrong as one of the, wealthiest countries in the world with our technology and our brilliance of just, supposedly of like, for justice and for all. We are women and we are not being listened to. We are being neglected medically. We can't do anything with malpractice. The laws do not apply to us. So we are left with suffer or death and families to be diagnosed with this disease with absolutely on every level of just being left to continue to suffer. And at this point, with me building this platform and talking about this exposes that women are going to continue to suffer. if this is not talked about, these conversations need to be talked about. You talking about and listing all of the screenings, labs, and testings that you have had, they need to be mandatory as early as 10 weeks pregnant throughout the pregnancy. And if diagnosed PPCM, peripartum cardiomyopathy, this will continue and follow throughout your life. And this is just the simple awareness of what testing, screenings, and labs that a woman should have. And it's a matter of life and death.
Yeah, it really is. It's not something that costs a lot of money for them to do. I mean,
No.
As a self-employed family of 4, we pay almost $2,000 a month for our insurance.
Great.
So like, I feel that when I walk into a hospital in the United States with that insurance plan, I shouldn't have any questions about care. And to the point where even when I did have my hyperthyroid and I didn't know it, but I was having all these cardiac symptoms and I told them, they left me sitting in the ER waiting room for 4 hours and then gave me a drug test before I could see a doctor. So it was okay for them to charge my insurance a 10-panel drug screen, but I'm telling them I'm a heart failure survivor with palpitations and cardiac symptoms, and I'm left in the ER for 4 hours.
Yeah, and
But
Canada,
we'll give you a drug test to see the doctor.
and
but not a
Canada
B&P
pays
or
zero money.
Nope.
Now,
and I paid $2,000 a month for them for what?
Yeah, I'm a Teamster because I'm a location manager for motion picture industry. I'm a local 399. I'm in like 4 unions. So, but my Teamsters union is really, my insurance is motion picture, pension, and health plan. I kept getting these things that come in, 18,000, 10,000, 28,000, but it kept saying, this is not a bill. This is not a bill.
Like an explanation of benefits.
Yeah, because I'm a Teamster, so they covered everything. I mean, my union was like shocked because I was in this union for over 18 years, working on TV shows, which we work, sometimes I was a workaholic. I'd work sometimes 20 hours in one day, sometimes 18 hours, because I'm the first one there, the last one to leave as like a location manager. Or if I, did acting, I was on the TV show JAG, and, we'd be working like, 12-hour days. And then, I drive an hour home, an hour there, or wherever set we were. And it's like, with having like, this active career and this and having like just being so healthy to having my times of death called, I've had to reroute my entire life, and from which is why I started this platform, because I started to notice that I stopped taking TV shows. My locations and producers that I've been working with for over 18 years, the insurance company, they said, you've never once been sick ever. And you work around the clock, and I see you get like a checkup here, a checkup there, to your times of death called. What happened? They know me. Because when you're in like a union for almost over 18, 20 years, and you're completely healthy, to like literally, they were my proof. And they said, Lindsay, we're so grateful and happy that you lived, and we're going to cover everything. That was over, it was over $288,000 continuing. I didn't have to pay. Most women in America have to pay that when you're diagnosed with this disease. Mm-hmm. Now, Canada has 0 monthly insurance, 0 birth bills, 0, they are completely cared for, health, wellness, and they have the SFLT1 diagnosis with the PIGF, the placental growth factor, in gynecology. So they are diagnosed during pregnancy, and then even if they do have PPCM and they do have to follow-ups, they're covered.
Yeah.
American women, we are paying almost $2,000 a month for our health insurance. We have to still women have to still cover the birth of a heart failure pregnancy, which sometimes women, it takes up to over a decade or even more. You have to work most of your life until that bill is paid off.
Luckily for me, I was at a hospital that had a financial assistance program. So I was able to get written off, so to speak.
Sure.
Because my income level at the time when I was, 23, it was just, I had left my job because I was giving birth to a child and I wasn't going to drive 2 hours, there and back every day. So they took our financial hardship and they wrote off what my insurance didn't pay. So I didn't get a bill, thank goodness.
Blessings. Yeah.
But
it's like we shouldn't have to.
I know that there's plenty of women out there that if you don't cover for Medicaid, Medicare, obviously Medicare is only elderly people in the United States. But if you don't qualify for Medicaid, if you're not financially poor enough to qualify for that, you're either, until like we recently changed the healthcare marketplace, you were either uninsured or you were in debt. And that was the two options.
And so, and I don't know if this requires a new legislation, a different type of bill, but, hopefully somebody who is watching this and, hears that we're obviously not just talking to hear ourselves speak. We're doing this on behalf of the woman who's watching this that's maybe, wanting to have the awareness of why women in America have, the suffering of and the death of maternal mortality that is extremely common, not rare, just rare for diagnosis because we don't have it at all in gynecology.
Pass away without knowing. I mean, we still see articles every week on Facebook of mother dies, father left with 2 children, you know what I mean? And we all wonder,
I'm posting all the time.
Cardiomyopathy, we all wonder that. Whenever I see a new mom die, I always wonder, was it PPCM? Because how can
we don't know. And when they give us statistics in the United States of America, it's like, how can you do that? We don't have a mandatory test. We don't have a diagnosis. So where are you getting that information from the ones that are diagnosed? Because let me tell you, it's not accurate at all.
Especially when it can happen up to 6 months postpartum. You're not even thinking at that point it's related to your pregnancy anymore.
And that's why we're talking about this today. And, thank you so much. I mean, this was, insightful, informative. It was just, definitely, a very well, informed interview for anyone who's watching this today. And hopefully, somebody can listen to this and either it might save a life, it might help an idea on how to, grow this movement for, I know this disease is global and every woman is like, literally fragile, but the United States of America women, we have other challenges to beat this system of this disease because there is, there's no functionality whatsoever. It's just
there's so many women like us that are just like not in the mainstream. Like it shouldn't take a famous woman having to deal with this and go through with this to bring awareness to the world because there's so many women like us that deal with it every day and are diagnosed every day. That why is it because we're not celebrities? We don't get our word out and we don't get to. So I would
let me tell you about the celebrities. And I won't mention any names, obviously, but this is they are women. This is a woman disease. They can actually make a difference. Their voices can save lives, and they're charging nonprofits for a story of $8,000. Now, if I didn't have this and I was like, let's say I had over 1 million followers and somebody came to me and said this about this disease, I would immediately say, I will use my voice. I have 1 million followers. This cannot go on anymore. I have yet to find a woman that's a celebrity that has
A care
literally to get over herself and to step up, use her voice, and not charge $125,000 for an interview, $8,000 for a story, or that might just delete or not. Like, it is appalling. And I am embarrassed. And these celebrities, they know who they are. You know, if they're not probably going to watch this, but they know who they are and they don't care. And that's what hurts. It's because women that are celebrities, because they're celebrities, they have an image that they're not willing to help other women. And I just find that very disturbing. And
I hope sisters and cousins and themselves don't have it happen to them, and they deal with the traumatic experience that it does bring to a whole family. It's not just to the mom, it's everybody.
And, you know, Kim Kardashian, she experienced this. You know, Serena Williams experienced this. Beyonce experienced this, but nobody will speak up. Nobody will say anything. You know, look at Jessica Simpson. Go to her.
I remember her pregnancy.
Yeah, go to her Instagram. Her feet, she used cups to suck out the infection, which actually is a very smart idea. I mean, hey, you know, get a magnesium drip, get the fluid out, or suck it out. I mean, I guess it doesn't matter as long as you get it out. But, you know, she could have really taken this disease and been like, you know, Queen Victoria, you know, and she just let it fall through her fingertips, charges $125,000 just to even like say anything about a pregnancy disease. No, that's not okay. Especially when you have experienced it and you can actually save lives and create a pregnancy movement that will save women. I mean, you hear all these strong women that are celebrities, but where are they? Where is their strength? And that's where I feel like, you know, I work with celebrities every single day. Almost, like literally. I mean, I've worked with James Woods. I worked with Spike Lee. I've worked with, you know, I've worked with, oh gosh, everything. Kevin Hart. I've worked, you know, men and women, and I've shared this information. I have given them on set, whether it was a PPCM fund swag bracelet or a keychain or somebody. And at the time, even Kevin Hart's wife was pregnant. And I told, you know, his bouncers, his security guards, and, you know, there's a higher death rate for women in the Black community, and there's very specific genetic blood codes. Wouldn't he want to know that information? Wouldn't his wife want to know that information? I mean, I'm at the point where I even did a live FaceTime on set. You know, here I am with very, very established, beautiful celebrities. And, you know, when I tell them this, you know, and even the woman from, she was on that gynecology show. Gosh, I can't even remember. Babe, what was that show? But anyway, she was on Kevin Hart. Anyway, I told everybody, no one cares that women have been giving birth since the beginning of time and is still dying like it's the 1400 when it's so easily prevented.
Yep.
What the Fit? It's called What the Fit. If you've never seen the show, it's hilarious. It's called What the Fit on YouTube. I love Kevin Hart, but I'm kind of disappointed that the fact that, you know, here his wife was pregnant. All he had to do was go to the website. He probably looked at this as education as fearful, not at looking as educational as like it can actually save maybe your children's life someday. I mean, it's really, for me, as I consider myself a celebrity, I walk on set. I know how to run a set, you know, with my hands tied behind my back. I've been doing it for over 18 years. I've been writing top TV shows. And, that's when I just decided I'm not going to take, I think I turned down like at least, I can't even tell you how many TV shows I've turned down in the last like 8 months. And I have solely dedicated myself on getting in front of the camera, and I work more behind the scenes. But at this point, it's like we can't depend on anyone to take this challenge for all women that obviously can't even make a post or share a post for less than $100,000 or $8,000.
That's crazy.
And they're women, and they should be volunteering.
Yeah. Not
taking money from sick women that need a new heart. I said, well, can you negotiate with me? I mean, I got a 20-year-old who actually needs a new heart, and that's expensive. Like, new heart, spreading the awareness and giving it to a celebrity so she can, whatever. New heart, I mean, it's like, come on.
Yeah.
So for me, I'm frustrated because here I have access to all the celebrities. I do.
Yeah.
But the issue is the unwillingness, just like the unwillingness with, the doctors, the OBs, the unwillingness to listen and to learn and to not take this information as fearful, but take this information as life-saving, and that there are preventions. And what you don't know can kill you, and what you don't know can hurt. But what you do,
I had never heard of this until I was in a hospital bed with a cardiologist telling me that's what I had. And even then, like, it really didn't set in. Like, it wasn't until probably 2 weeks later that I actually got on, and I wasn't even on Facebook then. So like, it was not even like, I didn't even have those groups to reach out to say.
Sure.
So I had found the A Mother's Heart website that Dr. Fett had run, which was like the original thing that we communicated it on. And that's when I finally learned the term peripartum cardiomyopathy. I don't even remember hearing it at the hospital when I was diagnosed. It was just pregnancy-induced heart failure. So my dad was actually the one that had gone home and read it online and told me the term. So like, I actually knew what the name of it was because I had never heard of it. And even still to this day, 13 years later, when I share like on my own Facebook, like maybe one person will like it. And it's just like, oh, there she is talking about that PPCM again. And it's like, they're just like dumbed down to it now, to the point where like, yeah, every year she shares it. Yep, we just, same thing. And it's like, wait until, you have somebody that that has this happen to them. And then it won't just be like, oh, there she is with that PPCM stuff again. Because
I know, it's funny. For a while, because I have like over 4,000 or 5,000 friends on Facebook. A lot of them are like birth workers and things like that. But so half of them are like, I don't even know. But when I post Liam, my son, I'll get like, I was like getting like hundreds, of likes and hearts and comments and everything. And then the next day I'll post something about peripartum cardiomyopathy, like, this woman either died, or this mother sharing about her daughter that died, or, just a husband who's talking about his wife that died and baby. And I'll get maybe 1 or 2, 3 likes. Then I'll post Liam again, or my puppy, and I'll get like 100. I'm like, okay, so Facebook's not broken with PPCM, because I see all like, and I did this. I'll do it like, and I can see that, okay, people are there. They are watching. They're just not responding.
Yeah, they just ignore it. They just let it be like blinders.
Yeah. Right. So if it's not joyful and lovely and all these buttercup roses.
When I tell people like face to face and they're like, oh my God, like that happened to you. But then it's like they forget about it an hour later. And it's just
absolutely.
Like, it doesn't have any importance to them because they don't know anybody personally that has experienced it and gone through it. And, and some families don't even understand the severity of it and how detrimental it is to a whole family unit, and not just the mom who's suffering. But I mean, I know that as a mom, I would rather have it be me 100 times than have something wrong with my child. But I would have taken the condition to me 1,000,000 times than having had something wrong with my kid when she was born. So It's just so sad that people like seem to not care when we try to raise awareness. And
it is. And that's also what this is going to show is that it's common. It's not rare. It's rare for diagnosis, and that the ones that are suffering, it's not their fault. It's literally the system. It's practice and policy. It's lack of training, education. It's lack of FDA not approving the diagnosis for women to be diagnosed in every hospital, OBGY office, including in the books for ACOG. That needs to change. Preeclampsia group, I don't know what they're, what are they doing? They're not collaborating really with peripartum cardiomyopathy. They make a little type of blurb. They have authority. And they can take that leadership on, but they're not. So they are quietly. Yeah. But we need it. We need a presence. Well, yeah. The Heart Association is finally just starting to come up because women are starting to speak up. But it's like, it's taken to 2022, these big associations, they need to collaborate or something. It's not like they want money, fine, because it's not, for us, it's not about money. Our lives are priceless. Yeah. It's about support, and the lack of it is severely lacking. And, today, again, thank you so much for your time. I really enjoyed talking with you, learning about your story and, venting on my own time here because it really is, we are living proof of the painful truth of women in the United States that are living through and watching other women suffer through this preventable maternal mortality. So thank you again for your time today. And I look forward to many years of, your friendship and, working together to hopefully continue spreading the awareness and for many others to listen. And hopefully there will be change.
Yes, hopefully. Thank you for having me, and I appreciate the time.
Thank you. Have a wonderful rest of the day.
You too.
Thank you.
Bye.
Thank you for joining us and listening to the PPCM Fund podcast. If you haven't already, please like and subscribe. PPCM's Painful Truth is made possible through the generous support of donors like you. Help us spread the awareness by donating at ppcmfund.com or click the link below to become a member through Ko-fi. Have a great day.